So here's something you may not know. HPV-related cancers are becoming more common in men now. In fact, 1 in 4 men have cancer-linked HPV infections now. So this is according to a new study which is published in the medical journal JAMA Oncology. That news is leading some doctors and researchers to really push the importance of vaccination in boys, despite the fact that it is more commonly associated with cervical cancer in girls.
So here today to tell us more about the HPV and this new study, we have Dr. Benjamin Keidan. Thanks for being here.
Thanks.
He is an internal medicine physician with Boulder Community Health. So first of all, tell us more about HPV. Let's define it, first of all, for people who may not know.
So HPV is a human papillomavirus that's responsible. Everyone knows about cervical cancer, but I think a lot of people forget about throat cancer in men and boys and also women, and also anal cancer and genital warts. So it's got multiple things that the vaccine is protective against.
Okay. And I remember when HPV, this vaccine came out, it was really popular. It was like pushing for parents, get your teen girls vaccinated. Why now are we seeing this with boys and men?
Well, 2 reasons. One, because we know that it's protective against cancer in men, and we're seeing lots of throat cancer in men that are HPV positive. There's been some famous actors that have had HPV in the throat. Also, we're looking at rates of vaccination in boys is much lower than we expected, about 20%.
So who's eligible then for that vaccine?
So typically we start at 11 to 12-year-olds, although you can start as young as 9 and as late as age 25 you can catch up. And so we're recommending anyone 11 to 12 all the way up till 25 if they haven't been vaccinated should be vaccinated, both boys and girls.
Okay.
We all know that there's a lot of parents that are opposed to vaccinations. Is there any other way to prevent this besides the HPV vaccine?
Well, the good news is that this is highly effective. It's almost 100% effective against cervical cancer, genital warts, and throat cancer, but unfortunately there's no other way to prevent it.
Yeah. And I read part of the study says estimated more than 9,000 cases of HPV-related cancers occur. That's just in men. That's remarkable. That's something I hadn't heard prior.
Yeah, I mean, I think I'm glad you brought that up, because we all think of the 30,000 or so cervical cancers, but the laryngeal cancer is really a growing concern that we're starting to see quite a bit.
Okay, so it should be on everybody's radar.
It definitely needs to be. And cervical cancer really is one of the most preventable types of cancer, yet we keep hearing about it.
Well, I think it's because we really haven't gotten vaccination to be mainstream. We have about 40% of women are vaccinated, so we have a lot of room to improve. We could prevent a lot of deaths.
Absolutely. All right, Dr. Keidan, good information.
Thanks.
Thank you. Thanks for coming in on a holiday day.
Yeah, we appreciate it.
We appreciate it. All right, let's turn to Lisa now. Just got to look at our first alert forecast.